Welcome to the Functional Gastrointestinal Disorders Education Session for patients attending pelvic health physiotherapy at Ashford and St Peter's Hospitals. This video is designed to help provide an overview of things that may impact your gut symptoms and discusses ways you can help to change these. You can break the session down into smaller chunks if you prefer, and can listen to it as many times as you like. If you have been referred to the service, you will receive a one-to-one appointment when you are at the top of the waiting list to discuss your symptoms with a specialist pelvic health physiotherapist. In this session, we're going to cover what the gut is, what are functional gastrointestinal disorders, the common symptoms, the potential causes, who this affects and risk factors, how to diagnose them, and how to manage the symptoms. We will talk through the different stress responses, lifestyle changes, and types of medication recommended. The gut refers to your digestive tract, which is a long tube that runs from your mouth to your rectum. It includes a main group of organs: the esophagus, bile duct, green branches, stomach, small intestine, and large intestine or colon, and a few adjunct organs like the liver, gallbladder, and pancreas. Its walls contain a layer of muscles which can contract and relax in a coordinated fashion to convey food. These movements are called peristalsis. Functional gastrointestinal disorders are complex, but it includes common conditions that are characterized by persistent and recurring gastrointestinal symptoms. They are not fully understood, as they are not caused by a structural or biochemical problem. This means that we are unable to identify a cause for your symptoms with tests and images, but they can affect any part of the gut. Some of the common symptoms of functional gastrointestinal disorders are heartburn, which is characterized by a burning sensation mid-chest and can be worse when bending or lying down. Constipation, that can cause tummy cramps, difficulty going to the toilet to pass a stool and/or hard and small stools. Regurgitation, which means bringing food or drink back up. It can cause stomach ache or discomfort and leave a horrible taste in your mouth. Dysphagia, when there is difficulty swallowing and the feeling that food or drink is stuck in your throat. Diarrhea, which are loose or explosive stools and sometimes causing difficulty for you to get to a toilet in time. Abdominal pain in a form of cramps. It can be sharp or dull pain, sometimes accompanied with nausea or vomiting. Flatulence, which can be excessive wind or belching or an inability to hold wind. Bloating, described as feeling uncomfortably full and tight. And dyspepsia or indigestion, which can cause you nausea, vomiting, feeling uncomfortably full, and stomachache. Functional gastrointestinal disorders affect up to 40% of people at any one point in time. IBS, functional indigestion, and functional constipation are among the most prevalent functional gastrointestinal disorders. 49% of women reported at least one functional gastrointestinal disorder, compared with 37% of men. A higher risk for functional gastrointestinal disorders is associated with a family history of similar disorders, smoking, fatigue, and other chronic pain syndromes. It has been shown that the way the individual's body responds to stress and anxiety can also increase the risk of functional gastrointestinal disorders. It is important to notice that food allergies and intolerances do not cause functional gastrointestinal disorders that might trigger symptoms in some people. Investigations will be carried out to rule out serious problems such as gastrointestinal cancer, inflammatory bowel disease, and celiac disease, which is a gluten allergy. If these are clear and you have these symptoms, then functional gastrointestinal disorders will be diagnosed. We are learning more about functional gastrointestinal disorders all the time, and it is now known that they arise due to alterations in brain-gut communication, more commonly known as the brain-gut axis. These changes in gut-brain axis are caused by complex reasons, including early life events and coping styles, learned behavior, alterations in gastrointestinal function, and associated psychological factors. Functional gastrointestinal disorders often coexist with other conditions. The more common of these include chronic pain, anxiety, and depression. It is not known if this occurs before the gut symptoms or as a result of them. The gut is sometimes referred to as the second brain. The reason for this is that it can communicate independently of the brain. The gut has a huge surface area and is the body's largest sensory organ. Whenever we experience periods of stress, anxiety, low mood, or emotional distress, this has a direct influence on our gut. High periods of stress mean that the brain borrows energy from the gut, causing digestion to slow, blood supply to the stomach is reduced, the layer of protective mucus around the gut thins, our immune system lowers, and communication between the gut and brain becomes more sensitive. This happens to all of us, whether we have a gut condition. However, if you experience regular gut symptoms or other gut sensitivity, then these changes and symptoms can be made worse. As well as the brain communicating to the gut also communicates directly to the brain. The gut produces around 90 to 95% of our serotonin. This is a chemical in our body that is responsible for feeling safe, soothed, content, and at peace. Therefore, if your gut gets irritated by any external factors like foods and drinks, exercise, sleep, toilet habits, hormones, or medications, this can lead to a change in psychological well-being, such as increased stress or anxiety and low mood. The gut symptoms you experience are mainly triggered and maintained by the way the gut and the brain interact with each other. Our brain communicates with our gut via the vagus nerve. The vagus nerve is linked with an automatic nervous system in our body. This means it helps to regulate the functions of our internal organs such as the heart, stomach, and intestines. It functions automatically and unconsciously. It controls two major body systems: fight and flight response, and the rest, digest, and repair response. To improve your gut symptoms, you need to learn how to trigger your rest and digest system. The two systems are opposite to each other. The flight or fight response is a series of actions designed to help you survive, to either fight danger or run away from it. The fight or flight response causes digestion to slow down or stop, and blood supply to be redirected away from the stomach and sent to the muscles. The stomach and small intestines reduce activity, leading to nausea. In addition, the kidney, large intestine, and bladder slow down. This can cause an intense need to go to the toilet. It also dampens our immune system, which impairs the body's ability to heal itself and prevents the release of natural painkillers. The rest and digest system plays an important role in maintaining both physical and psychological health by helping the body to calm after stress. It helps to balance out the effects of the fight or flight response by lowering blood pressure, slowing down breathing, relaxing muscles, and sending blood to the stomach and intestines to improve digestion. The fight or flight response is activated whenever we experience a threat. This could be a major threat, like coming face to face with a bear, a minor threat, like sitting an exam, or a hypothetical threat, such as imagining yourself tripping up in front of a group of people. Your brain and body cannot tell the difference between a real-life threat and an imagined one. When the stress and anxiety persist, the threat responses get triggered more easily and stays elevated for longer. We can think of it like a sensitive car alarm, which can't tell the difference between someone trying to break in and a cat jumping on the roof. The management of functional gastrointestinal disorders is not about fixing the cause or finding a cure, but treating the symptoms. It's important to understand that your symptoms can change over time, as well as your priorities and goals. The main treatment focus are stress response, lifestyle and medication. This can help manage our symptoms and encourage the body to return to rest and digest. By now, you should feel that you understand the connection between your gut and your brain a little better, and how important it is to identify signs of fight or flight in your body. You see, your nervous system is constantly scanning the environment, looking for cues of safety and cues of threat. It does this unconsciously. It is not something that you are choosing to do. It is possible for us to change this through practices that help the nervous system find calm and balance. With practice, you can stimulate the vagus nerve and improve its function. This will trigger your rest, digest, and repair response. When you actively work on your vagus nerve, you help moving your body out of the stress response, but also you make it easier for your body and mind to stay calm in times of stress. Sometimes there is nothing we can do to stop our nervous system trigger the fight or flight response. Your brain is trying to protect you the best way it knows how to. But there is an alternative way to respond to stress: the tend and befriend approach. This is a different behavior response to fight and flight system. The stress is still there, it hasn't changed, but our response to it is different. You can improve your digestion, reduce bloating and pain, relax your muscles by practicing daily activities such as slow, deep belly breathing, focusing on lengthening the exhale, singing, chanting, humming and laughter, meditation and mindfulness, yoga, particularly restorative yoga, touch like hugs or massage, exercise that you enjoy, positive social relationships. The rest and digest system isn't as easily triggered as the stress system, so you need to practice these activities regularly to help you move on from fight or flight quicker and with less effort. This could be compared to training a new skill. Once you practice it enough times, it will become intuitive. You don't have to think about the steps your body has to do to achieve the desired outcome. The tend to befriend approach focus on connection. People typically display behaviors that involve nurturing and seeking social relations. Tending to yourself, to others, and seeking out social support mediates the effects of stress on the body, leading to more resilience and well-being. When we respond to stress from a tend and befriend approach, it has a markedly different response to the body By releasing the love hormone, our body mirrors the feelings of bravery and courage. You might find it helpful to acknowledge the flight or fight presence by giving it the name, here's stress, or any label you like. The act of acknowledging or labeling it can help reduce its intensity over time. When something related to your gut happens, instead of beating yourself up, you might want to imagine what you would say to a friend in that situation. Instead of withdraw and avoid leaving the house, you might want to normalize your feelings and explore your options. Our lifestyle can massively impact on several aspects of our body function. Setting a consistent and healthy bowel routine can help improve your bowel function. Typically, we open our bowels between 3 times a day to 3 times a week. The frequency may also change over our lifetime due to a number of factors. This is also normal, but if sudden changes happen, they should be monitored. It is important to answer your urge to empty at any time of the day within 15 to 20 minutes where possible. Give yourself plenty of time to open your bowels. It takes 10 to 15 minutes to effectively empty them. When sitting on the toilet, use a small stool to support your feet so that they are a little higher than your hips. Keep your back straight and lean forwards, resting your elbows on your thighs. Relax and breathe slowly into your belly. Imagine your belly as a balloon, filling and expanding with each breath in, gently contracting and shrinking with the breath out. Thinking of breathing sideways can also help. To trigger your bowels to empty, imagine as if you are wearing a belt around your waist without holding your breath. Expand your waist muscles against the belt and focus on relaxing your anus so the stool can pass down. This is called the brace and bulge technique. Regular exercise is also an important part of keeping your bowels moving. Our bowel is a muscle, and if we don't move regularly, it will become slower. Exercise can improve the bowel function and transit time, therefore help with constipation. It can also reduce stress, improve mood, and lead to better sleep, all of which impact on gastrointestinal symptoms. It is not about the type of exercise, even though a combination of strength, flexibility, and cardio is the most beneficial for overall health. Choose something that you enjoy and can keep for long term. Remember that exercise is not the same as having an active job or lifestyle, as these don't carry the same benefit. Reduced sleep has been associated with several health issues, so it's not surprising that sleep affects our gut. Studies have shown that sleep can affect your gut health through disturbances to hormone levels. These changes can prolong your state of fight or flight and increase inflammation of the gut lining. Sleep deprivation can also affect certain hormones that control hunger, leading to an increased appetite, particularly of foods that provide a quick energy boost, like processed carbohydrates, sugars, and fats. There are several things you can start doing to help improve your sleep. You can start by having a regular routine. A good sleep routine should include having a set time to start winding down and going to bed and getting up at fixed times, ideally every day, including weekends. Your sleep routine starts before you get into bed. Try to build in time every evening to relax. Avoid mobiles, tablets, and computers at least an hour before bed, as they produce blue light that prevents sleep. Reading, listening to soft music or a podcast, or sleep meditation can all help if you have trouble falling asleep. It's generally easier to drop off when it's quiet, dark, and cool. although the right sleep environment is personal, so try different things and see what works for you. You can try wearing earplugs, putting your phone on silent, use good curtains or blinds to keep your room dark, and avoid unwanted lights by keeping clocks out of view and phones facing down. Make sure your room is the right temperature for you and well ventilated, as a cool room is usually better to sleep in than a hot or stuffy one. Some people also find it helps to play music for sleep, such as ambient sounds like rainfall, gentle music, or white noise. A good diet and regular physical exercise can help us to relax and get better sleep. And the opposite is also true. Avoid eating large meals close to bedtime. Try to also ditch the bedtime caffeine like coffee, tea, and energy drinks. Alcohol or nicotine if you can, because these are stimulants that make us more alert. The general advice is to avoid stimulants 1 to 2 hours before bed. Regular exercise helps with sleep, but avoid anything too energetic in the 90 minutes before bedtime if you find it stops you from sleeping. Many people are aware that what we put into our gut will impact its overall health. Dietary changes can often help manage your symptoms, and sometimes simple changes are all that are needed. As a starting point, aim to have 3 healthy, balanced meals a day. Take time to eat in a calm environment and chew your food well. You might find smaller meal sizes are better for your symptoms. You might want to keep a food diary to identify which foods trigger symptoms and identify eating behaviors. Stimulants and depressants like caffeine and alcohol should be avoided, as these can cause dehydration and increase symptoms of bloating, abdominal pain, and excessive gas or wind. Drinking the correct amount of fluid is vital to help maintain a good stool consistency. It is recommended that you drink 6 to 8 glasses of water per day, which is approximately 1.5 to 2 liters of fluid. This can be a combination of water, milk, herbal teas, juices, and even soups. Nutritional guidance advises we should aim to eat 30 grams of fiber a day. Fiber passes through the body as waste and helps food to pass more quickly. When increasing fiber in your diet, make sure you do it slowly and start with a low dose, as rapid increase could induce symptoms of bloating, abdominal pain, and gas. Soluble fiber is fiber that gets dissolved in water. This type of fiber helps stool to become softer and bulkier and slows down digestion. You can find soluble fiber in the flesh of fruits and vegetables, beans and lentils, oats, and psyllium husk. Insoluble fiber does not absorb or dissolve in water, but it holds water very effectively like a sponge, and it helps bulking our stool motions. You can find this type of fiber in the skins of fruits and vegetables, seeds and whole grains, kidney beans and chickpeas. A mix of both types of fiber is vital for bowel health. If you have been advised to follow a low FODMAP diet, guidelines state that you should do this under the supervision of a trained professional, such as a dietitian. Therefore, it is not recommended to start the diet on your own, as it can be overly restrictive and have long-term effects on your nutrition and colonic microbiome. There are medications that help alleviate common symptoms of functional gastrointestinal disorders like constipation, diarrhea, and pain or cramps. A lot of them can be bought over the counter, so please speak to your GP or pharmacist about these. An antidepressant can be considered as second line to manage stress, anxiety, and gut sensitivity. Usually the doses are lower than when these medications are taken for depression. If you think you could benefit from taking an antidepressant, you can speak to your GP or consultant who can recommend the best one for your specific needs, taking your medical history into account. There's growing evidence for using probiotics to improve the microbiome, but no evidence of the long-term effects or what is the best dosage. Probiotics have helped improve global IBS symptoms like abdominal pain, bloating, and flatulence, and they can be trialed for 2 to 3 months. Some phone apps can help tracking symptoms and lifestyle factors related to sleep, stress, and diet. If you feel you need extra support with your mental health, there are several places you can find information and make a self-referral depending on which GP you are registered with. Alternatively, you can contact your GP for support and signpost it. For more support with sleep and diet, you can find extra information in these websites. All the links will be available in the comments section below. Thank you for listening. If you have any questions, please contact your pelvic health physiotherapist.